Well, I believe that we should look at each patient as an individual that has individual unique concerns and problems, and I think that if we can see them as an individual and frame their problem from an individual, unique way, then I think it allows us to connect more effectively with them and then treat them more effectively, and just recognize that disease states and concerns come up differently in different patients, and once you connect with that person and frame their problem from their perspective and their background, then I think that allows you to treat them much more effectively. I am a gastroenterologist, so I perform various kinds of endoscopic procedures, including EGDs and colonoscopies, but my specific area of expertise is within the small bowel. Specifically, I treat a lot of patients who have a disease entity known as obscure GI bleeding, which is typically that they have bleeding sources somewhere in the small intestine that are inaccessible to standard endoscopy. And so I perform a procedure called balloon enteroscopy, which allows me to navigate the small bowel from both above and below much further than standard endoscopies. I also read capsule endoscopies, which are camera pills that patients swallow that can detect bleeding and other lesions throughout the small intestine. Well, it's interesting, I've actually, having grown up here, my father actually has been on faculty here for many years, and I've watched the place develop over time, and it really went from a pretty small place around 30 years ago to a first-rate, top-tier university that provides all the both primary, secondary, and tertiary care amenities that one could really, hope for. And I think that we have all the facilities and people and a great team of both physicians as well as nurses and other ancillary staff that not only make it a therapeutic environment in terms of the capabilities that we possess, but also a warm, nurturing environment where everyone works well as a team and works well as a team to treat patients. And I would choose it personally for myself. I think, again, as long as you recognize that each person is unique, and that their individual disease process is going to be different from somebody else's, their individual concerns are going to be different from somebody else's, and their background is going to be different from somebody else's, that once you recognize that and understand them and understand that they are unique, I think you can do much more for them. I think rather than looking at them as having a specific disease, you look at them as a specific person that happens to have this problem. And once you, I think, frame it in that way, you can really change what is possible in terms of their treatment. I grew up in Charleston. I actually went to the College of Charleston for undergraduate, and I went to MUSC for medical school. I then went to the University of Virginia for my internal medicine residency and spent an additional 2 years there as an assistant professor of internal medicine as a hospitalist. I then decided to go into gastroenterology, so came back to MUSC for my fellowship, which was 3 years, which I completed this past June. And I had always known that I would eventually want to come back to MUSC, and I was very happy to be able to get a very competitive fellowship spot here. And then once I had gotten that, for me it was a fairly simple choice in the sense that I wanted to stay in an academic environment. I knew MUSC. I had a reference of comparison at the other facility that I was at, which was also excellent, but I was highly impressed with MUSC. Other than having been from here, I also just view it as an outstanding facility and a place where I could take excellent care of patients and also have a thriving career.